ready.
Hi.
How are you?
Hi, doing well.
Good.
Hi, I'm Amanda. I'm the pharmacist
you.
that's going to be counseling you on your medications today. So these prescriptions are for Alex Jones.
That's correct.
What's your relationship to Alex?
I'm Alex.
You're Alex? Okay,
Yes.
perfect. Okay, if you'd like to have a seat, Alex, we'll get started. Okay, so the purpose of today's session is we're just going to kind of go over your chart, answer some questions that you have, and make sure that you're know what's going on with your medications. Okay. Before we start, do you have any questions for me?
I do not.
No? Okay. So the first thing I want to start with is these two prescriptions that you brought in today. One is for doxycycline and the other is for NuvaRing. What did the doctor tell you that you're taking? Why did the doctor tell you you're taking the doxycycline?
The doxycycline's for my acne.
Okay, and
Yeah.
have you ever taken this one before?
I have not.
You have not? Okay. So with this medication, you're going to be taking one tablet twice a day.
Okay.
So you can take it in the morning and then right before bedtime. It's good to take it with a glass of water.
Okay.
If you're noticing it's causing your stomach to be upset, it's okay to eat a little bit of food with this
Okay.
one. Okay? Do you take any other medications?
Right now I'm currently using the NuvaRing
Mhm.
for contraception, and then I take the generic Singular
Mm-hmm.
and escitalopram for anxiety and depression.
Okay. What time of day do you take those oral medications?
I usually take them in the morning.
Okay.
Yeah.
So it'd be a good idea, and then we have a little pill bottle that maybe, or a little pill weekly reminder that we can send home with you today. So it's going to be okay to take your Singular, your Lexapro, and then the first dose of your doxycycline all in the morning.
Okay.
And then what time of day do you think would be best for you to take your second dose?
Probably around dinner time after work sometime.
Okay, and will that be an easy time for you to remember?
Yes.
Okay, perfect. So you're good on when to take that one. And I see on your medical history that you've been having some problems with your acne.
Mm-hmm.
And this is something the doctor discussed about trying the doxycycline and seeing how that works?
Correct.
Okay, perfect. With the doxycycline, it's going to be really important that you are careful when you go out in the sun. This is a medication that can cause your skin to have a little bit more sun sensitivity. Okay. Make sure you're wearing sunscreen, long sleeves, maybe a hat. Do you work outside or are you outside a lot?
I do, but I usually wear a large brim hat and long sleeve shirt.
Okay, so. Perfect. Okay, so just make sure you're continuing to do that. If you're noticing that you're breaking out really easily, you're having really severe sunburn, that's something you need to call us or tell your doctor about.
Okay.
Okay. As you start to take the doxycycline, if you're having anything like a rash that's not a sunburn, chest pain, or you're having difficulty breathing, that could be a sign of a really bad adverse reaction. So again, you would want to call your doctor or call us as soon as possible. If you're having trouble breathing, maybe you need to go to the ER with that one.
Okay.
Not a common side effect, but just something to kind of keep in
Sure.
mind. I also noticed that with you have been having problems with acne, and we have here that you're eating fried food 4 to 5 times a week. Is that just something out of convenience? Do you enjoy it? What's the reason that
probably, of course I enjoy it, but
Right.
but it is just convenience. I should probably stop.
Okay, yeah, that could be definitely contributing to the amount of acne you're having. So just try to think of when you're going out to eat. Say if you're going to Chick-fil-A, instead of getting the fried sandwich, maybe get the chicken wrap or something like that. So as you're going forward, try to be aware of the amount of fried food you're eating, and if you are eating fast food, check the menu because there could be other options available for you. Make sure you're drinking plenty of water, staying hydrated. That can help with the skin issues as well. Okay. So the next thing I wanted to talk to you about was your NuvaRing, and I see on here that you're having some complaints with dosing. What are some issues that you're having with the dosing of your NuvaRing?
I just had some problems with it staying in and stuff, so I just not really problems, I guess, but you know.
So with this one, it is some women do experience the ring coming out. This is okay. Just as soon as you notice it's coming out, go to the restroom. You can take it out, rinse it with lukewarm water. Just tap water is fine. You don't want it to be too cold or especially too hot, because the hotter it is, the more it can activate those hormones in it. So just tepid water. It's okay to rinse it and put it in as soon as you can.
Okay.
Is it ever out longer than 3 hours?
No.
No? Okay, perfect. So within 3 hours, just go ahead and put it in. You're going to be okay. If it ever is out longer than 3 hours, you need to use a backup method of contraception for at least 7 days.
Okay.
So if it's out for how long?
3 hours.
3 hours, perfect. Okay. And if it's ever out for more than a week, then at that point, I would recommend calling us or calling your doctor, because then that can kind of reset your cycle. He may say it's okay to go ahead and restart with a new ring, or you may need to. There may be some other options for you, but if it's out longer than a week or 3 hours, definitely you're going to need to using a backup method.
Yeah.
Okay. And you don't want to use a diaphragm because the ring and the diaphragm can kind of interact, with just the protection they have. So using a condom or a backup method like that.
Sure.
Okay. I also noticed that you're having some complaints with the Singular and with your Lexapro. What kind of issues are you having with those?
I guess my biggest complaint is probably just having to take it every day and trying to remember it and just stay on track with remembering it.
Okay. So like I said, we're going to try and get you a weekly pill thing to fill up every week. Hopefully that'll kind of help you to remember, okay, today's Monday. Let me go ahead and take all of these. So we'll do that. And then I also have on your chart that you're kind of still having some issues with depression and anxiety. What type of issues are you having with that?
Oh, just feel a little down sometimes.
Okay. Okay. Is it affecting your your work, your day-to-day life, things like that?
No.
Okay. It might be time to talk to your doctor if you are still having issues, especially with your Lexapro, about increasing your dose. You are on the lower end of the dose, so increasing your dose might be something that could help you with that as well. So the next time you go into your doctor, I would definitely address that with them and maybe have that discussion that it's time to increase your dose.
All right.
Okay. Let me go in here. How do you store your NuvaRing? Because I see you're going home with 3, so you're going to have 2 that you're not using right now.
I usually keep it in the refrigerator.
Okay, that's fine. If for whatever reason you want to store it at room temperature, that's okay too. It just can't be at room temperature for more than 4 months.
Okay.
So keep that in mind, but in the fridge is fine with that one. Your other medications, where do you typically store your Singular and your Lexapro?
Usually just by the sink.
Okay.
In the kitchen.
Okay, so one thing with that, you may want to keep it either higher up in a counter. You want to keep it away from moisture and light. So just be aware, don't keep it out right by the sink. Maybe put it up somewhere higher, away from kids, pets, things like that. But definitely away from moisture, because that can just affect the tablets and things like that. And since you're adding the doxycycline, I would keep all 3 of them in a cool, dry place, away from sun, away from moisture.
Okay.
Okay, so something to remember with that one. So missed doses. If you ever miss a dose with this new one, the doxycycline, you want to take it as soon as you remember it. If it's within a couple hours though of your next scheduled dose, you don't want to take 2 at the same time. So it's okay to skip the dose at that point and then just take your next scheduled dose. Okay. So say you normally take this at say 8 in the morning and you remember at 10 o'clock in the morning, it's okay to take it. Okay. But if it's in the evening and say your evening dose is 8 p.m. and it's 7 p.m., don't take your morning dose, just take your evening dose and then continue on. So say you wake up first thing in the morning, you forget to take your doxycycline and it's 10 a.m., what would you do then?
I'll go ahead and take my dose, my morning dose.
Perfect. That's very good. And then for the NuvaRing, since you're inserting that one for 3 weeks and then you're removing it for 1 week, do you have a calendar? Do you keep a notification on your phone or anything? How do you remember to take this?
I do have a calendar in my bathroom that I just keep on.
Okay. Are you usually pretty good about maintaining this one? Has there ever been times where you've forgot to put it in, or were a day late or a day early, anything like that?
No, not usually. I'm pretty regular with that.
Okay, excellent. So just keep maintaining the calendar for that, and that's going to be good. Let's see on here. And then for your seasonal allergies, some issues maybe that you're having with the Singular, are you still experiencing allergies? Are you experiencing them all year round, or is it just certain types of the year?
Just usually in the spring, but they're not really bad since I've been taking the medication. It works really well.
Okay, perfect. Excellent. So let's get with that one. And then, at this point, do you have any more questions for me?
No, I think you covered it.
Okay, perfect. So we're going to go ahead and send you out with your new medications. If you have any questions, our phone number is on the prescription. Always give us a call if you ever have any issues or concerns, okay?
Okay.
Okay. All right. Well, thank you, Ms. Jones, for coming in today, and look forward to seeing you here in the future, okay?
All right. Thank you.
Thank you.